Hi everybody, this is a video about Mycoplasma. Several months ago I posted a video about Mycoplasma and someone posted a question on that video, so I'm just reading that question off here. So it says, I recently got a test confirmation that I no longer have the infection, but I still have symptoms, things like sharp vaginal pains, middle ear infection, and inflamed nasal passages, etc. I believe I contracted this in April of last year. Sexual health practitioner says it may be the new norm. So thank you for posting the question. Technically there are no question marks there, but I think it was posed as a question. As per usual, nothing that I'm saying should be construed as medical advice. This is for informational purposes only, and if you need medical advice, please talk to your healthcare provider to get that advice. When it comes to really any type of systemic microbial infection, and granted, Mycoplasma doesn't have to go systemic. Mycoplasma could just cause pneumonia, which is why it's called Mycoplasma pneumonia. There are other species of Mycoplasma as well. There's Mycoplasma genitalis, which can just cause like a bacterial vaginosis. But Mycoplasma can be systemic. And so when it comes to microbes that can go systemic, there's always, in my mind, a question mark of like, well, how accurate is the lab testing in question? And with certain microbes and certain lab tests, we have a pretty good sense of how accurate they are. But an absence of a lab test tells us, okay, the lab test didn't pick anything up, but is that test 100% accurate at picking up the absence of a microbe? And to my understanding, when it comes to Mycoplasma testing, we can't say definitively that it's going to definitely be able to rule out its presence. So one question that would come to my mind if a patient came to see me and said, well, I have this Mycoplasma, I still have some symptoms, but my test result's negative now. I'm wondering, well, maybe it's something else causing the symptoms, or maybe it's always possible that the test may have been wrong, or it might be a false negative. So that's one possibility. So another thought just that came up based on this question is, should this be considered a new normal? And again, can't say anything specific about this case because it's not my patient and I don't know all the ins and outs. But I can say from my experience that it's incredibly, incredibly rare that there would be a new normal of symptoms like this for someone who didn't have, like in the absence of some type of a like severe injury, like there was some really bad accident, a nerve got severed or something, and maybe there's chronic pain or chronic, tissue dysfunction following that. Okay, that happens, life happens, and maybe that is going to be a permanent reality for that person. But in terms of symptoms that are induced by something like Mycoplasma pneumonia, which is a very, or some other Mycoplasma species, which is a very generally treatable infection, it would be very odd to me that would become a new normal. When things become a new normal related to an infectious microbe, in my experience to date, it's oftentimes because the appropriate treatment, or the comprehensive treatment, I should say, has not been figured out yet. And when it comes to microorganisms like Mycoplasma, especially if it's more of like a vaginal or sinus involvement, I'm always thinking about biofilms. When there's a persisting set of symptoms, like, oh, we're throwing antibiotics at this, we're throwing antimicrobial herbs at this, like, why are there these persisting symptoms? It could be that the microbes are hiding it behind biofilms, and those haven't been addressed. And sometimes we really have to plug away at biofilms, sometimes for a prolonged period of time, like sometimes several months, to really get them all eradicated, depending on the length of symptoms and how long the infection has been there in the first place. If a patient came in to see me, they were treating them for some type of infection like Mycoplasma, and they say, quote unquote, only been sick for maybe like 6 to 12 months, and then they have some persisting symptoms after it seems like we've done as much as we can with treating for the infection. I'd be much less likely to think that there's a significant biofilm component compared to a person with the same history, but they were sick for 10, like say more than, well, I was going to say 10 to 15 years. That would definitely put biofilms higher up on the likelihood list. But even if they're sick for like a couple of years or more, I'd be thinking maybe biofilms are more of an issue. Potentially an issue. The other thing that springs to mind when I'm listening to this or reading this question is maybe there is some type of a microbial hypersensitivity. So in some cases, the Mycoplasma or the other infectious entity is indeed gone. It's been killed off. There are no biofilms. There's no residue left of that actual living microbe in the body, and yet the microorganism has catalyzed or stimulated this immune system dysregulation that it's kind of left behind like a bad taste in one's mouth. So I've talked about this many times in other videos, any of my videos where I talk about low-dose immunotherapy or microbial hypersensitivity, then this is a concept I've talked about there. And sometimes the solution, well, in those cases, oftentimes the solution is using low-dose immunotherapy or an analogous type of therapy to help reestablish immune system tolerance and regulation, and then things improve quite nicely. So thank you for the question. I hope that this was helpful. If anybody has any questions about this topic or anything else, please post in the comment section below, and I will answer as soon as I can.